Welcome to Pepsi's Corner. I'm Nurse Perpetua and I'm also a midwife. I have over 10 years of working experience as a nurse midwife. So in this video, we are going to be talking about preconception. We are going to be talking about, I want to share my experience on how I was able to conceive fast without complications. How I was able to conceive fast without complications. What were the steps I followed? What were the things I did to enable me achieve my results fast? So the main thing I did was preconceptional health, preconceptional care. A lot of people do not know about preconceptional care. Preconceptional care is a woman's health before she becomes pregnant. Before you start thinking of getting pregnant, you need to go to the hospital for preconception care. You need to go to the hospital because you should not just dive into pregnancy without preparing your body for the journey. It's a whole journey. It's a whole process. The body needs to be prepared. You should not just surprise the body like that. No. You should get the body prepared. Involve the body in the preparation. Let the body know that the body is preparing to receive something so that the body will not reject that thing when it happens. So the main thing I did was preconceptional care. So now, during preconception care, what is involved? What is supposed to be done? You need to go to the hospital. Go to a good hospital. And when you go there, they will run you some medical tests. They will do infection control. Most importantly, you need to check yourself for all sexually transmitted infections. You need to check yourself for every one of them because they are very, very important when it comes to conception because they prevent conception from happening, especially chlamydia, pelvic inflammatory disease, syphilis, gonorrhea. You need to check yourself from those things. Make sure that you don't have any of them. And if you check it and you have it, it is very important that you treat it before start thinking of getting pregnant. You should not get pregnant while you are having those infections. They are not good for the health of the baby. You should treat yourself properly before you start thinking of getting pregnant. So preconception care mostly is supposed to be done 3 months before you think of getting pregnant. 3 months. You need to prepare your body 3 months before you start thinking of getting pregnant. So do you also know that the eggs you ovulate as a woman in 3 months' time, you can start preparing them now. You can start nurturing them to be healthy from now, and you ovulate them in 3 months' time. So that is also involved in preconception care. In preconception care, it is also involved. Also, I had to quit some bad habits. I had to eat healthy. I had to quit habit like drinking of alcohol. If you are thinking of getting pregnant, especially if you are above the age of 30, if you are above the age of 30 and you are thinking of getting pregnant for your first time, you need to quit alcohol consumption. For those who smoke, you need to quit smoking. Stop smoking totally. You need to quit it. You need to quit all bad habits when it has to do with your health. Quit all bad habits before you think of getting pregnant. Because as a woman reaches the age of 30, the ovarian reserves, the egg in the ovary start declining. They decline drastically. And when they decline, the quality of the ones produced also decline. The quality of the eggs also decline. The number of the eggs also decline. Because when you were born, when you give birth to a female child, that child is being born with the number of eggs that child will have throughout that child's life. So if you give birth to a female child with 3 million eggs approximately, as that child is growing, by the time that child reaches the age of 30, those eggs must have reduced to about 1.5 million eggs. By 2, they will decrease by 2. So the most fertile age of a woman is the age of 18 to about 22. Those are the most fertile age of a woman. So I had to quit all bad habits like drinking. I had to stop drinking. I had to start eating healthy. I had to go to the hospital with my partner because preconception care is not only for the woman, it's for the two partners, because while the woman is doing her own controls, the man also has to do his own. The man also has to do his own part to ensure that the sperm that he will give to the woman will be healthy and potent. So I had to go to the hospital, do some lab tests, and thank God everything was good. I was placed on folic acid. I had to start taking folic acid. Folic acid is very, very important when you are thinking of getting pregnant. Folic acid is very, very important. You take about 400 to 800 microgram of folic acid daily. There are some that comes as 400 microgram. In that case, you should take 2 daily. There are the ones that come as 800 micrograms, in which case you take 1 daily. So what is the use of folic acid now? Folic acid prevents birth defects. It prevents neural tube defects like spina bifida. Spina bifida has to do with the spinal cord, with the neural tube in the spinal cord. Folic acid has to prevent that. And also research has shown that a lot of women who consume folic acid for a period of say 1 year, it boosts their fertility also. It boosts their ovulation also, and it gave them hyper ovulation. Hyper ovulation meaning they were able to ovulate 2 eggs in a month, and eventually if those 2 eggs get fertilized, they will have twins. So folic acid is very, very important during preconception care. You start taking it at least 3 months before you start thinking of getting pregnant. The next thing is, if you have any medical condition whatsoever, you need to put it under control. You need to make sure that medical condition is under control before you start thinking of getting pregnant. Also, I had to stay away from toxic substances. There are a lot of toxins that affect the reproductive hormones. Toxins like the ones found in nail polish. The nail polish we put every day has a very toxic substance that affects reproductive hormones. I had to stay away from nail polish. For those who know me, I don't do too much of makeup. For those who know me, I had to stay away from those things because I knew that those toxins were not needed in my system at that moment. I had to stay away from it. Also, there's another toxin present in plastic bowls, plastic plates, plastic cups, all these plastics that will put food and keep in the fridge. I had to stay away from all those toxins. I had to stay away from those plastics. Though you cannot say you eliminate them totally, but at least you should try to be at least 70 to 80%, because in our day life now, we cannot do without those plastics. So I had to stay away from such toxins. I had to also stay away from stress. You know, a lot of women, when they are struggling to conceive, they don't actually have a reproductive problem. But because of the fact that they stress a lot, it caused them not to be able to conceive, because the hormones involved in stress interferes with their normal reproductive hormones, and by so doing, it will cause them hormonal imbalance. And you see somebody will tell you that I had all the signs and symptoms of pregnancy, but suddenly I started menstruating. It was stress. Stress was playing over your intelligence. So stress affects a lot of women. I always tell my women that I coach that keep away from stress. Make sure stress, in short, positive vibes are what you need at this moment. So at this point, if this video is being helpful to you, a subscribe will help me a lot. A subscribe will let me know that I'm creating valuable content to my community. So another thing I had to do after, like I've already mentioned, you should treat sexually transmitted infections, consume folic acid. Another supplement I was consuming was vitamin E. Vitamin E is very important during implantation. We are going to talk about implantation in my next video, how it happens and what can prevent it. So vitamin E enhances implantation. It helps prepare the uterus to be receptive to receive the fertilized egg. You know, most of the times women, fertilization takes place, but implantation fails. And before you even know you were supposed to be pregnant, it has gone out because implantation was not successful. So vitamin E enhances implantation. It helps the uterus to be receptive when the fertilized egg comes for implantation. That's another supplement I was consuming. Another thing I did was to observe optimum rest. Make sure you rest at least 7 hours. Rest has a positive effect on the brain also. Rest is very, very important when trying to conceive. The next thing also that I did was to go for blood grouping. A lot of people do not know that some blood groups are not compatible when it comes to conception. Some blood groups are not compatible. Rhesus factor. So I had to go for blood grouping to ensure that my blood group and that of my partner was compatible. And thank God it was good. It was compatible. Okay, so now let me just throw a little light on blood grouping. We are not going to go detail because I will take it in another video. If you have a positive, let me say you have blood group A, and your partner has blood group A, but you have blood group A negative, and your partner has blood group A positive, it is very important you let the hospital know, especially if you are already pregnant. It's very important you let them know, because when you give birth, there is a vaccine that they will administer to you. It's called anti-D. It's given within the first 72 hours of birth. Is given to you, the mother. What is the use of this vaccine? This vaccine, the use is to prevent the positive antibodies from your husband from reacting in your system. Because if that vaccine is not given, you have received the positive antibodies that your husband gave through the sperms, and they are in you. Now, you have had a healthy pregnancy. Some will not even be healthy, some will flush out, but most of the times you will carry the pregnancy, especially if that is your first pregnancy. You will carry it till term. When you give birth, everything will be fine, but subsequently you will discover that when you carry the second pregnancy, you will always have a miscarriage. And you'll be like wondering what is happening. It is because that positive antibodies are in you. So now they are fighting against any foreign object. Anything that comes in you, they see it as foreign and they send it away. So it is very important to check your blood group and that of your partner. Make sure you check it and make sure you let the hospital know that this is the situation of our blood group. Because this issue of blood grouping and the rhesus factor has caused a lot of women to be childless, because imagine you have a negative rhesus and you are with somebody who is having a positive rhesus, and you get pregnant for that person and you flush it out. That positive rhesus is in you. When subsequently now maybe you get married and you want to start giving birth to children, you always experience miscarriages. Why? Because of the abortion you committed. So that is another complication, another effect of abortion. That's another effect of abortion, which is not good. It has caused a lot of women to be childless, not knowing it was as a result of that positive antibody. So generally, preconception care can improve your chances of getting pregnant. And it can also increase your chances of carrying a healthy pregnancy and eventually giving birth to a healthy baby. Imagine that you didn't go for any preconceptional care and you are having sexually transmitted infections like gonorrhea, and you get pregnant with it. You carry that pregnancy. Maybe you are going to the hospital for your antenatals and they are giving you drugs. You are playing hide and seek with them, which is always the case. That's always what our women do when they come to the hospital and we give them those drugs. They don't take it. They don't take it serious. Now, that gonorrhea has caused you not to have a healthy pregnancy. And eventually, you are not going to have a healthy baby because you will give birth to that child. That child will be delivered with ophthalmic problems. Will have gonorrhea of the eyes called ophthalmic noniatorum. You have ophthalmic problems. You have eye issues. You always have milk, water coming out of the eyes, and that will not be good for a very young baby going through that type of pain, going through that type of sickness. Whereas you, the mother, you had the opportunity to prevent it from happening. So preconception care is very, very important. So basically, that was what I did. I went for preconception care and I had to increase my equality. We are going to talk about equality, how to increase your equality in my subsequent videos. So you will not want to miss those videos. You will not want to miss those subsequent videos. So if you have not subscribed to this channel, I implore you to subscribe to this channel so that immediately I upload those videos, you'll be the first to get them. And I'm always answering questions in my comment section. And also I have a community of women I'm coaching. I have a community of women. I have an ebook on the fastest way to get pregnant. The fastest way to get pregnant. So preconception care has to start at least 3 months before you think of getting pregnant. A lot of my women always inbox me and they are like, they want to get pregnant, like this month. I tell them, no, it's not done like that. Prepare your body. It's not done like that. It's not done like that. Don't just want to get pregnant as fast as possible without putting one and one together to get what you want. We should work. It's a process. We should start first things first. Ensure you have gone to the hospital and your health is okay. You don't have any issues when it comes to health. Ensure your partner has gone to the hospital and his health is also okay. And you should, most importantly, you need to know your menstrual cycle. You should study your menstrual cycle. You should know what works for you. Know how many days cycle you have and when your ovulation is, and everything will be good to go. So basically that's what I did, and that is what I decided to share with us today, because I realized that a lot of us are not informed about preconceptional care. So bye-bye. See you in the next video. Don't forget to give a thumbs up to this video if it was informative to you. Thank you.